Democratic governors across the country are joining together to counter the Trump administration's controversial changes to health care policy. 15 Democrat governors from the most populous blue states, as well as Guam, have formed the new Governors Public Health Alliance. The goal is to share data about disease outbreaks, prepare for emergencies, deploy experts, and coordinate public health policy. Those are all responsibilities traditionally held by the CDC. Joining us now is one of the Democrats in that alliance, Colorado Governor Jared Polis. Governor, thanks for being with us. Governor, talk to us a little bit about the vision for this coalition. Democratic governors have already formed regional initiatives to provide some vaccine guidance. What will this new alliance tackle, and what type of information can you offer your constituents without real resources from the federal government?
Well, you know, what we're all experiencing here across all 50 states is a diminished federal capability on public health. Obviously, during the shutdown, most pronounced, but even assuming government can reopen, what does the national stockpile look like for masks and gloves? What does the capability look like to interact with organizations that protect public health across the world? It's severely diminished nationally. So states are stepping up, but you know what? There's a lot of efficiency to do it together. And so that's why we have actually more than a third of the country, I think 34% of the population of the country, now working together, where states are coordinating more efficiently, not reinventing the wheel in every state, and stepping up to make sure people are empowered to take the actions they need to live safe and healthy and productive lives.
Don't we all want that? Was there a specific Trump administration policy or action that you saw that was the tipping point for you to get involved here?
It's really just the increased uncertainty and chaos. We know the CDC, federal health institutions, are providing less and less. They've been gutted. We actually have a shutdown right now. They're barely even there, skeletal crews. Even when they reopen, many people are gone. So what gaps exist? I hope the federal government has full transparency about what they can and can't do. What is the state of the stockpile? What is the state of disease and pathogen tracking? I certainly hope that they're able to do some or much of that, but we will be able to fill the gaps. And that's what we want to reassure the people of our states, that we'll have the basic kind of health information and backup that we need in times of crisis by working together.
So right now, your group is entirely made up of Democratic-led states, but not every Republican has been totally on board with the administration's health policies either, especially unfounded claims about Tylenol and autism, as we've been reporting. Here's what Senate Majority Leader John Thune just told our colleague Ali Vitale on MSNBC in an exclusive listen.
I've dissented a number of times just in the last few weeks.
For example, on what?
Well, on Tylenol, for example.
Okay.
FCC. I mean, you go back and check the record.
Do you feel the way RFK Jr. is talking about that is dangerous?
Well, I've said that I think that if I were a woman, I'd be talking to my doctor and not taking, advice from RFK or any other government bureaucrat for that matter. But I just think that there are subjects and issues on which we have differences of opinion. I typically litigate those privately rather than publicly.
So given John Thune's sentiment there, do you think there are Republican governors who would join your alliance? And are you talking to them, even privately, as he suggests?
Yeah, absolutely. To be clear, this is in no way a partisan effort. We welcome Republican governors to support public health. It's really about how can we fill in the gaps that are left by the diminished federal capabilities in this area. States can do that on their own, especially big states, but there's a lot of efficiencies by working together. For instance, to stockpile the equipment we need to provide the type of guidance, get the latest information to residents of our states. So yes, we welcome both Republican and Democratic-led states. And frankly, if the CDC continues to diminish and provide less and less value to states and to residents of our country, then I think you'll continue to see states step up, both working independently and together.
Governor Jared Polis, it would be nice to see some bipartisanship. Working together would be novel in this moment. Thank you so much for spending some time with us. We appreciate it.